Welcome to day 4, aortic valve options in aortic valve stenosis. We're going to talk about a special circumstance, the young woman who wishes to start a family but currently needs aortic valve replacement for aortic valve stenosis. The dilemma here is deciding whether or not one should choose a mechanical valve with the need for blood thinner and the difficulties and risks that poses should you become pregnant, versus a tissue valve which takes away those risks but means that you will require further treatments in the future. Let's think about the first one, the mechanical valve. Well, if you're a young woman, then a mechanical valve is a great solution for you. You will need a blood thinner called Warfarin for the rest of your life. But if you're planning to start a family, you really need to ensure that you do not become pregnant whilst taking Warfarin, because Warfarin will damage the baby in the first 12 weeks of your pregnancy. So it's very, very important if you're a young woman on Warfarin because of a mechanical valve, or you're on Warfarin for any reason whatsoever, that you do not consider becoming pregnant without discussing it with your doctor. If you do decide to become pregnant, then we can change the Warfarin for a different type of blood thinner, usually in the form of a heparin scratch. There is no other alternative right now. Later on in your pregnancy, we would be concerned more about the risk of bleeding whilst on a blood thinner. And so obviously later on, your obstetrician in the hospital would keep an eye on those sorts of things. But there is risk. So the risk really in the first 12 weeks is the risk of damage to the baby because of the damaging effects of Warfarin. And later on in your pregnancy, the risk is the risk of bleeding complications. Now, if you are to choose a tissue valve, then we take away those risks, and this might be a good solution for you, particularly if you decide that you're going to have more than one baby, because that would take a number of years. The problem is the tissue valve will not last forever, and almost certainly you will require another treatment in the future. One solution that I found really quite useful in young women who are planning to start a family but need aortic valve surgery for aortic stenosis is to perform surgery using the Inspiris Resilia tissue valve. Now, you will remember in video 1 and 2 I discussed mechanical and tissue valves, and the Resilia valve in the lab setting seems to have a durability that is 4 times longer than the traditional tissue valves. In the humans, we've seen that this seems to be the case up to about 6 or 7 years, but we don't know what it's like out to 15 or 20 years like most tissue valves. But the early data is promising. Now, the beauty of using the Resilia is that it means that you can take your time to decide upon your family, you can have more than one child, and we can keep an eye on the tissue valve to make sure that it isn't wearing and tearing. But should it wear and tear, then we can reoperate on you, and either, depending upon your age at that point in time, choose to put in a mechanical valve, or we can choose to put in another tissue valve. Now, the beauty of having your surgery through a small minimally invasive cut here between the ribs is that it's more cosmetically appealing. It doesn't mean a broken bone, but it also preserves the need for further surgery through the breastbone in the future should you require. Now, some people advocate the idea that you have a Resilia valve now, and then later on you have a TAVI valve placed inside the Resilia. And you'll remember from the last video, TAVI is a treatment through the groin. This is perfectly feasible, but we do not really know the long-term results of something like that. So for now, if you're really young, a tissue valve might be the best option to tide you through your need to have children. And then after that, if the Resilia valve fails, we would be able to perform repeat surgery. The first surgery through the keyhole, the second surgery through a mini breastbone cut. And that would be a great solution for you.